Pathopharm 2 101. So first we have promethazine hydrochloride. It is a prototype drug, and its action is to block dopamine receptors in CTZ. Promethazine hydrochloride is an antiemetic, and it's used for post-operative nausea, vomiting, chemotherapy, and radiation sickness. The side effects are moderate sedation, photosensitivity, and EPS. A big one is CNS effects and mild anticholinergic symptoms. It is a dopamine antagonist, but the class is phenothiazine. Some common adverse reactions are extrapyramidal symptoms. That is when you can't control your muscle movements. Also, we have seizures, dyspnea, and hypohypertension. Use caution in glaucoma, GI obstruction, COPD, and DM. Assess patient for dehydration due to excess fluid loss from vomiting. Check vital signs, provide mouth care, and monitor bowel sounds for hypoactivity and hyperactivity. Next, we have diphenoxylate with atropine. The action is to decrease GI motility. It is an antidiarrheal. Side effects include abdominal pain, constipation, and dry mouth. Adverse reactions would be angioedema and pancreatitis. It's contraindicated in severe liver impairment. Monitor your fluid and electrolyte imbalance. Diphenoxylate is an anticholinergic, and the side effects include CNS depression, abdominal pain, and dry mouth, like I mentioned. Caution in glaucoma. Do not take sedatives. Next, we have Biscodol. It's a laxative. The action is that it increases peristalsis by irritating sensory nerve endings in intestinal mucosa, and it produces a watery stool. It's used for bowel preparation for surgery and short-term constipation. Results take orally 2 to 8 hours and rectally 50 to 16 minutes. Side effects are nausea, vomiting, diarrhea, abdominal cramps, and proctitis and rectal irritation. Patient teaching would be not to overuse it and to exercise to help with peristalsis. Next, we have psyllium. That's a laxative, but it is bulk forming, so it draws water into the intestine and increases bulk and peristalsis. It's used in constipation and hypercholesterolemia. Psyllium produces well-formed soft stool. Administration: you mix it in a glass of water or juice, you stir and drink immediately, and then you fill up with 1 full glass of water because you could choke, because the powder is super thick. Insufficient fluid intake causes intestinal obstruction. That is a side effect: abdominal cramps, nausea, vomiting, diarrhea, flatulence, dizziness, and drowsiness. Moving on to peptic ulcers, we have aluminum hydroxide, an anti-ulcer and antacid. Aluminum hydroxide, the mechanism of action is that it neutralizes gastric acidity, and it is used to treat hyperacidity, gastric and duodenal ulcers, and then reflux. A side effect of aluminum hydroxide is constipation. For teaching, report pain and do not take at mealtime. Next, we have famotidine. The action of that is to block H2 receptors of parietal cells in the stomach to reduce gastric acid secretion. It promotes healing of the ulcer by eliminating the cause. So the side effects of this would be headache, dizziness, agitation, erectile dysfunction, and a big one is vitamin B12 deficiency. Some consideration with this one is that older adults with less gastric acid need a lower dose of famotidine. It's used to treat gastric and duodenal ulcers, GERD, and pyrosis. And then for teaching, you don't drive until you're stable, and then make sure to report the pain, and then assess the electrolytes and monitor the gastric pH. Greater than 5 is desired. Next, we have pantoprazole, or PANTS. The action of this would be to reduce gastric acid by inhibiting hydrogen and potassium ATPase. It's an anti-ulcer drug, proton pump inhibitor, or PPI. The side effects include headache, dizziness, diarrhea, abdominal pain, constipation, vitamin B12 deficiency, and hypomagnesemia. The proton pump inhibitor just means that this medication acts on the proton pump, and the proton pump tells the stomach to secrete gastric acid. The use for PANTS PPI is to treat gastric and duodenal ulcers, and the really big one to remember for PANTS is that it also treats H. pylori, and it prevents NSAID ulcers, and it also helps treat GERD. Life-threatening is all the penias, like leukopenia, and also hepatic failure or liver failure. Adverse reactions is GI bleeding, And like I mentioned, vitamin B12 deficiency is a side effect. Next, we have another anti-ulcer, which is the last one, and it is a pepsin inhibitor. It's sulcrafate. The action is that it combines with protein to form a thick paste covering ulcer, protecting the ulcer from acid and pepsin. The side effects are headache, drowsiness, dizziness, dry mouth, and constipation. Administration considerations with this one is to give on an empty stomach 1 hour before meals and bedtime. Administer the antacid 30 minutes before or after sulcrafate, and do not give with other drugs because it binds with certain drugs and reduces the effects. Adverse reactions of this one is angioedema, hypophosphatemia, and hyperglycemia.